Recording. And I'm sure Vicky had a wonderful introduction for you, Tracy.
No
I don't
problem.
have one prepared.
That's how I can introduce myself.
Yeah. So I'm gonna just go ahead and let you.
Okay, super. Well, thank you so much, to the East Bay CDS for inviting me to come and talk tonight. For those of you guys who don't know me, I'm Dr. Tracy Rainwaters. I've had an all equine chiropractic practice in the Bay Area for the last 16 years. And I've really specialized in working with sport horses. So I've been an avid dressage rider for about 25 years. And when I started into practice, it was actually my love of horses and riding that really got me into being an animal chiropractor. And I have an undergraduate degree in exercise physiology. And I went through human chiropractic school knowing that I always wanted to continue on working with horses. So as soon as I was done, I went to Options for Animals and attained my certification to do chiropractic care on animals and started practicing on horses right away. And I also had the opportunity to spend 7 years on the faculty at Options for Animals teaching the adjusting technique labs. So I was basically teaching veterinarians and fellow chiropractors the motion palpation techniques and the actual adjusting techniques for working on animals. So as I got into practice, it was really my love of dressage that really provided me this client base and this platform that I've had the opportunity to work on horses everywhere from dressage horses and event horses competing internationally to, casual riders. What I love about the California horse community is we have such a wonderful group of adult amateur riders that are so passionate about their horses and really, performing and riding to the best of their ability and really doing it at a high level. So it's really given me the opportunity, over almost 2 decades to really see, how horse breeding has changed. I have to say, we now have super athletes, the type of horses that we have access to, and I would say that most amateurs now have access to, have radically changed when we compare, the body style and the movement that we see, in the show ring, whether it's, in an international Grand Prix or a local training level test. Looks quite different than it did, 15 years ago, and it certainly looks very different than it did 30, 40 years ago. So that has really, while the athleticism is a huge bonus, and these horses can be really fun to train and ride, it's really changed how we manage our horses and how we can get the best out of their performance and really allow for, a happy athlete that's also physically sound. And what I've really found is in my practice, there seems to be, and understandably, a little bit of a disconnect or just a lack of understanding of, spinal mechanics. So how the body really works and moves and how to really identify, what is conformation, what is posture. And when we start to see changes in our horse's posture, that can really be the first sign of a lameness or a potential, issue that we could have long-term. So I'm just so honored to be here today to kind of teach you guys a little bit of, how we can really identify what's going on in our horse's body, how we can look at the outside and have a better understanding of what might be happening on the inside and how we can proceed so that we can hopefully avoid injury and have a really happy athlete. So, and please forgive me, I'm getting over a cold. So if I sound like I'm speaking through a snorkel, I'm really sorry. But let's get started. Okay, so we're just going to start with the basics. And before we get started, I'm going to leave time for questions at the end. So if you guys have questions as we go through, it would be great if you could just write them down. And then I think I would love for you guys just to pop on and we can ask questions in person and kind of go through everything. But let's start, in the most basic. So what is conformation? So conformation is the bone structure that we're born with. And it really is, once we are fully developed, there's very little we can do about that. So we're really looking at the genetic factors that play into how our skeleton grows and develops. So it's the length and the shape of our bones is what makes up our conformation. Now, when we're young, and this applies to horses and people, really all beings, our conformation can be influenced by our diet, So when we're looking at horses, if they're nutrient deficient when they're growing up, that can definitely affect how they grow and how their bodies develop. How much movement they have when they're young, their ability to be free in a field when they have these growing and developing bodies, has a really positive impact. And it's really what horses are designed to do, is to be in movement all of the time. So a lack of movement or a lack of ability to fully express movement through the body when these horses are young and growing can really affect conformation. So how that bone structure grows and develops over time. And then when we're thinking of our horses, hoof care in a growing foal, well, in a foal and in a growing horse can also radically impact conformation. So a lack of hoof care or inappropriate hoof care can affect how the limbs grow and develop. So when we think of conformation, just to recap, we're thinking of the bone structure that we're born with. And then when we move into posture, so posture is how our body responds to the dynamic forces that we place upon it. So this includes not only the skeletal system, but all of our muscles, our tendons, our ligaments, and our fascia. So how do all of these structures work together and in response to our activities of daily living? So if we think of us, if we work in an office, 8 to 9 hours a day, and maybe we commute an hour on either end of that, and we spend most of our day, carrying a lot of tension in our shoulders, sitting in poor posture, I'm sure we can all understand, how our body would feel over time. We don't typically feel in full vitality and able to fully move when our activities of daily living affect our posture in a negative way. So it's really thinking that our posture is very changeable, where our conformation really isn't once we're fully grown. So our posture can change within days, and it can change for the positive or for the negative. So really, when we're thinking about our horses as athletes long-term, to me, posture is key. So posture really gives us this beautiful insight into how are our horses adapting to a training program? How are our horses adapting to an equipment change or maybe a farrier change? All of these things affect how our horses' bodies can move. And a lot of that is being able, once we can identify some muscular changes that we can see in the body, it really gives us the ability to track over time, how our horses' bodies are doing. And it can really give us the first cue that, something may not be working so well for our horses. And I also think being able to identify good posture, and I'm going to just use the word ideal posture because I don't think there's any such thing as perfect conformation or perfect posture. But, having this understanding, especially if we're going to purchase a horse, can we look at the musculature and the skeletal system and go like, hey, this horse is, working really well through the body. The muscles look really developed. Everything is in proportion and it looks like it's doing really well versus, maybe it's not. And that will give you a clue, as you go into a pre-purchase exam of where you would want to take some extra radiographs or maybe get some second opinions on what's going on with the horse. So as our posture adapts and changes, and if we slip into poor posture, this becomes really problematic, especially when we're looking at a horse, is poor posture really can increase the load that's exerted on the limbs. So if a horse has an adaptive posture and maybe, they're over concussing both front limbs or just one limb in general, this over time can lead to lameness issues. So if we're over concussing a limb or a joint, we can get excess fluid in the joint, which causes increased pressure. And when we have increased pressure in a joint, that eventually, it can decrease blood flow to the cartilage that covers the bone surfaces that make up the joint. And it can also cause the cartilage to degenerate. And when the cartilage starts to degenerate in a joint, that is really the first stage of what we would call, arthritis. So making sure that our horses are using their bodies correctly and not overloading or over concussing certain parts of the body is really critical, not only for optimal performance, but for optimal soundness as well. So again, just coming back to unbalanced and abnormal loading of the limb, it just increases the risk of injury. So really just, posture really allows us to just understand how effectively our horses are using their bodies in motion, and not just effectively, but also efficiently. So any being in poor posture isn't able to efficiently or effectively use their muscular system or their skeletal system. So that can also lead to muscle fatigue. And as muscles fatigue, we will generally see a greater breakdown in posture. So if you imagine, like if you're starting like a new strength training program, the posture that we have and the proper mechanics is really important. But if we were to maybe lift too heavy and start doing too many reps, and we just kept pushing through with the goal of getting stronger, what we would see first as we start to fatigue is our posture is the first thing to degenerate. And once the posture goes away, we really run the risk of hurting other areas of our body. Okay. So what I've seen as the biggest effects on our horse's posture, number one is equipment. And that is everything from saddle fit, how our bridles fit, to the training devices that we use. And we're going to get into this later in the lecture, but one of the problems that I see in the modern sport horse is, horses that are lunged regularly in side reins. So the equipment that forces them in a posture that they may not be able to or have the strength and conditioning to correctly hold on their own can really affect their posture. We can actually, through doing that unintentionally, strengthen parts of their body that would be what we would call compensatory. So we can inadvertently strengthen opposing muscle groups that actually will not support a horse in correct posture. Saddle fit. It is, I think, the hardest and one of the most challenging jobs in the horse industry. We're taking a relatively immobile structure and placing it between two dynamic, sentient beings who are, on any given week, changing in, their fitness and their strength. So saddle fit is really critical. And we're going to talk about that a little bit more as we go through looking at pictures, additional posture, but really being mindful of equipment. I really find, really getting saddle fit checked at the bare minimum twice a year. I really think, especially if you're riding, training, and competing competitively, every quarter. So we're looking at every 3 to 4 months, because even a minor shift in saddle fit and balance, when we combine that with the mechanical forces of a rider who, none of us are in perfect fitness or in perfect balance all of the time. But when you combine a slightly imbalanced or weak rider with an out of balance saddle, the mechanical forces on the horse, I just read a study, they said are 2.5 times the weight of the rider. So that is the amount of force that's being put through the horse's back through the saddle. So equipment, it's imperative. And I think we owe that to our horses to make sure that our equipment is as good as it can be. Number 2 is rider balance and fitness. We really, we expect our horses to be performing. And I think, again, I see so much love, in the horse community towards their horses. And I feel like so much of people's, their resources, their intention, and all of their efforts really go making sure the horses are happy and healthy, and getting the chiropractor and the massage therapist and the acupuncture. But we really need to keep that balanced, and we need to kind of hold ourselves to the same standard that, we're taking care of our bodies. We're getting the support, whether it be through massage therapy, chiropractic, acupuncture, Pilates, physical therapy, to really be a wonderful and easy load for our horses to carry, so that our balance and fitness isn't impeding our horses. It's just enhancing their ability to do their job. And then hoof balance and hoof care. Everybody's heard the term no hoof, no horse. Hoof balance it's critical. If horses are standing on a foundation that is out of balance, we're going to see that reverberate all the way up through the rest of the body. And I will honestly say, I have so much respect for farriers and barefoot trimmers. It's an incredibly hard job. And I don't care how good anybody is, it is impossible to know what's going on accurately, with 100% accuracy. It's really impossible to look at the outside of the hoof and to know for certain what's happening to those internal structures. So I think part of managing these sport horses is really encouraging people, at least once a year to get shoeing radiographs to make sure that we're doing everything that we can to give our horses a really wonderful foundation to build a body on. And the last thing that I see as being a huge factor in a horse's posture is training. And, towards the end, we're going to talk about modern sport horses and how that's affecting training and what we can do to make that better. But again, pushing these horses along quickly or riding them in frames that they're not strong enough to hold is one of the things, it's the fastest way to make your horse's posture very vulnerable and can lead to lameness and injury. So I'm going to talk a little bit just about compensatory gait patterns. And a compensatory gait pattern is just a gait pattern that's abnormal. So it's an abnormal gait pattern that an animal has adopted to reduce pressure or pain on a certain part of their body. So much like us, horses tend to be either right-handed or left-handed. So they'll be dominant off of one side of their body versus the other. And what I'll normally see, like when I look at a horse, and everybody can do this the next time you're out at the barn, but if you stand your horse square on solid ground, you can stand behind them and just observe the general shape of their hip and their gluteal muscles just to see, are the muscles even and symmetric? When we look at the top of the hip, over the sacroiliac joints and those gluteal muscles, is the fullness even and symmetrical on either side? Looking at the hamstrings down the back of the limbs, are those even and symmetrical? Does one side look and feel tighter versus the other? And then we can move to the front of the horse, observing the shoulders, looking at, the chest. Are the chest muscles symmetrical? Looking at the barrel, do I see an even amount of barrel on either side, or is the barrel rolled out to one side of their body? And that can give us a clue, is this like a postural change? Is there a subtle lameness? Is there a body lameness? Do we have body pain that's contributing to how horses are loading and concussing their limbs? So compensatory gait patterns come from pain, primarily, restricted mobility, so that's in the joints, the muscles, and the fascia and the skeletal system, or hypermobility. And this is where modern sport horses really come into play. Hypermobility is having excessive movement in the joints. So when we have excessive movements, if we think of, especially the international horses that we're seeing now, just the range of motion they have in their limbs, if, it requires a degree of hypermobility, of having excessive movement, for horses to move that way. Now, if the limbs are moving with that much hypermobility or excessive movement, they also have that in their spine. So when horses are hypermobile, they have a much harder time stabilizing the core and stabilizing the spine. Now you can imagine, horses that are being ridden, if they have a hard time stabilizing their body, so the core and the trunk, you put a rider on that, and then we're also asking for these large dynamic movements. It puts these horses in a very, very vulnerable position where we're just seeing a lot of pathologies that are stemming from that. We're going to get into that in a little bit. So again, compensatory gait pattern is just any gait pattern that has been adopted due to either pain or some sort of biomechanical change in the body. So how does this affect soundness? So when posture changes, the weight distribution of the whole body changes. So typically horses they're designed to carry 65% of their weight on their front end, and the remaining 35% is carried in the hind end, primarily through the sacroiliac joints. So the sacroiliac joints are actually the primary weight-bearing structure of the hind end. And they also, all of that movement, all of that forward movement actually gets initiated through the gluteal muscles and the sacroiliac joints, and then it translates up the spine. So when we have horses that, whether their conformation has changed, where we have a horse that's what we call naturally uphill, so let's say the front limbs are longer than the back limbs, we no longer have this 65-35 weight distribution. And then when we add the force of being ridden and asking them to carry even more weight on their hind end, again, we're now opening these horses up to injuries, to the hips, the coxifemoral joints, the hocks and the stifles, in particular, become even more vulnerable. So increased forces in the spine and limbs, it nearly always leads to joint degeneration over time. So we really need to change the way we think about certain lameness issues, not only joint degeneration, but also kissing spine and navicular syndrome. So kissing spine, just briefly, for the longest time, we've really seen that it's a heritable disease, so that there is a genetic component. And I really believe that there is, some genetic components and some factors that, lead into kissing spine, and we know navicular for sure. I mean, that could be absolutely a heritable disease. But kissing spine can also be mechanical. So again, if we think of, we now have these really hypermobile, overly athletic, huge moving horses who can't stabilize their spine. And then we sit on them, and especially if we're not strong, fit, stable riders, gravity is working against us, and it's putting a lot of mechanical force on the back, which will bring those dorsal spinous processes, instead of sitting, parallel to one another, they can approximate and start to touch. So kissing spine, it can be purely biomechanical as well as being a heritable disease. The same goes for navicular syndrome. Initially, I remember when I was going through school, we were taught, navicular was really common in quarter horses, and, it was genetic. You could see, yearlings and 2-year-olds with it. And, and then I was taught navicular syndrome is the same pathology, but it's coming from a biomechanical source instead of a genetic source. So again, as we change how these horses are moving, and if they're constantly over concussing their front limbs because they can't use their necks correctly for balance, or they're being ridden, in a short frame when they don't have the strength to carry it themselves, that can lead to an over concussion of the front limbs, and we can see navicular changes in these horses. So again, just so important that we be really mindful of how our horses are using their body. Okay, so we're gonna do a little bit on how to evaluate posture. And I just wanna let you guys know, as we go through this, all of the horses that I actually picked from sales ads off the internet. So I felt all of these pictures, represent horses that were being sold as dressage horses, kind of out into the public. And it's really my intention as we go through this hour, nothing that I'm presenting, I have no intention for it to evoke shame or blame. It really, I just want this to be, a place where we can really start to develop our eye and not, cast any judgment, even as we take this information out in the world. I will be the first one to admit, when we're looking at a picture, and especially when we're looking at a picture of somebody who has a horse, it's to make a lot of judgments over a snapshot in time. I now have my horses at home. I don't have regular coaching help, so I videotape a lot of my rides, and I can be the first one to say, like, you can go through a video and take snapshots and just cherry pick the ones that look amazing, and then you can go through and there's some that look really not good. So this is where I also think developing an eye for posture and what the muscles are doing. Posture doesn't lie. So like a picture of somebody riding can be an awkward moment in time that doesn't in any way, shape, or form give us a complete picture of what's actually going on. But looking at the posture and the muscle structure and how the horses are using their body, that doesn't lie. I also want to say, and I want to be very careful here, when we start evaluating horses, we have to be really conscious too of like, there's so much here we don't know. And when you take this information out into the world, yes, we can look at a horse and find some things, that are less than ideal, but that in no way tells me, the history of the horse, their medical history, and what has already been done to help them and what hasn't. So, really, the intention here is to learn how to refine our eye, but also, not casting judgment on others and just being, really in a space of openness of really just wanting to do better for the horses. Okay, so the first thing we want to do, so we're going to have 4 basic steps that we're going to go through. And the first is, if you're going to go and evaluate your own horse, we want to get them standing on a flat level surface. Ideally as square as possible. Now, a lot of these horses you're going to see their sales ads, so they're not standing totally square. You know, we do the best we can, but we want to really look at them with what I would call a soft gaze. So we're not really looking in and keying on any specific area of the body, but just, you know, really allowing our whole vision to take in, you know, the whole horse and just note what we see. You know, how does the muscle structure look? You know, do the muscles look soft and supple? Healthy muscle tissue should feel like you're pushing on a raw steak. So, you know, looking at a horse, does it look like, you know, if you were to go in and push the muscles, you know, would that feel soft and pliable? You know, would the skins, you know, glide smoothly over the muscle? Or, you know, does this horse look shrink wrapped where, you know, the skin almost looks too tight for the muscular system and you can actually see, you know, where the muscles insert into the bone. So just taking the big picture, just kind of noting in general, you know, how does the horse look? You know, do you see any areas of tension? Do you see any areas of asymmetry that really draw you in? And then we want to look at the horizontal balance. So that's going to be, you know, looking at the ratio from like the hip to the shoulder. And then we're going to look at vertical balance, which is really the neck and the shoulders. Okay, so let's talk a little bit about longitudinal balance. So one of the ways we can evaluate, and it can kind of help us discern conformation versus posture. So longitudinal balance is really looking at, you know, is my horse balanced, you know, front to back? Are they built downhill or are they built uphill? And there's a couple different ways we can do that. Unfortunately, there isn't a gold standard that I can find. So not to confuse the issue, but when we look at longitudinal balance, so if we look at, you know, wither height to croup height, that can, if we see a discrepancy there, that's not always conformation. It can sometimes be posture as well. And I'll show you guys some examples as we go through. So we can look at wither height to croup height, and then you can also look at, you know, the tip of the elbow to the stifle. We can also look there. So truly, you know, if a horse is conformationally balanced, so if the limb structures have developed so that the limbs are, you know, in perfect balance, we should be able to draw a line from the elbow to a stifle and have it be straight. In going through and doing line drawings on pictures, hardly any horses have that. So I don't know, you know, how accurate that is. There's pros and cons to doing both of these. What I recommend is when you do the line drawings, which you can just do on an iPhone. I can show you guys how to do that. I would do both, because if one looks really off, if you do the other and the other's balance, that'll kind of help you discern is, you know, what's going on postural or if it's conformation. And I'll show you guys some examples. So longitudinal balance. We then want to look at muscle symmetry. Do we see any bulges or do we see any hollows? So, you know, like when we look over the long back muscles, you know, are they soft and round? Does every region of the back look like it, you know, just softly glides into the other? Or do we have like atrophy where the saddle sits and then the muscles behind, you know, the saddle where they tie into the pelvis, are they bulged up? I think a giant red flag when you guys are evaluating posture, you know, when you take the saddle off of your horse or you just observe your horse without any tack on, if you can see an imprint in the muscles where your saddle sits, that's a problem. You know, and it could be saddle fit or it could be some other pathology or just a general, you know, the lack of an ability to lift and move through their thoracic spine. And then we want to look at muscle quality. So are the muscles soft and round, or are they ropey and pronounced? So as we go through, I want to weave in some spinal mechanics so you guys can begin to understand how the spine is moving as we go through movement. And why I really wanted to talk about this is I feel like there's been a lot of information circulating the internet in the last year, you know, regarding spinal mechanics and how horses bend and move through their body, that while I can understand why that conclusion would be drawn if we're just looking at the outside of the body, when you understand how the spine is actually moving, there are just some ideas that aren't correct. So when we look at longitudinal balance, we really want to look at the lumbar spine and the pelvis. So the lumbar spine is the region of the spine that sits just behind the saddle. So we place the saddle over the thoracic spine where the ribs are attached, and the lumbar spine connects that thoracic spine into the pelvis. So the primary range of motion of a horse's lumbar spine is flexion and extension. So you can think of, if we do like a pelvic tuck on our horse and ask them to really round their back, that's what we mean by spinal flexion. And then extension is just the dropping of the spine. So the way the vertebra and the lumbar spine attach to one another, their primary range of motion is flexion and extension. Now, all regions of the spine can do, to some degree, flexion and extension. They can do rotation, and then they can do lateral flexion. So the lumbar spine is actually limited in rotation and lateral flexion, but can do a very high degree of flexion and extension. So when we're looking at the lumbar spine, we really want to look and see, how does that low back tie into the pelvis? Is it roached up? Do we see, a hunter's bump, over the sacroiliac joints? And I'll show you guys a great example of that. Or, do we see, is the croup and everything really flat? Like, is it almost a straight line, as we go through the lumbar spine into the pelvis? So if we think of those sacroiliac joints being the primary weight-bearing structure of the spine, we want to see a nice angle to the hip so that, when we have angle, we have shock absorption. Anytime we see a croup or a joint structure that's very flat, we automatically think decreased range of motion and a decreased ability to absorb forces that are being put through a joint. Okay, so this horse, this is Flash. And let's just start. I just want everybody to kind of notice, if we look at Flash with soft eyes, what do you see? Taking into account, how does his muscle structure look? As we observe over his withers, we can look at, his thoracic spine, looking at the muscling over his back. We can look at how that lumbar spine ties into his pelvis. And then we can look at, the angle of his croup. I'll give everybody just a minute just to kind of notice what you see and what your eyes are drawn to. So these are the line drawings that I did for Flash. So you can see, and it's really hard, to get the lines perfect, but the ruler was set at 0. So when I place the ruler at the top of his withers, when I measure from the top, he's actually technically in an uphill balance. So the withers are a little higher than the croup. I actually had a hard time, because of his color and the light, seeing where his elbow is. But, when I really look at, this bottom line is set at 0 degrees, so it's perfectly level. But when I look at, the balance between stifle and his elbow, to me, the stifle looks really flat and pulled up. So I'm show you guys what else I observe here. So we could say longitudinal balance on this horse overall, not bad. But what we want to look at is, his lumbar spine here. So hopefully you guys can see, like, we've got, this great big long wither. I think overall the muscling in his back looks very good. The muscling in his neck looks soft and pliable. He's got nice shoulder muscle. So everything looks kind of good until we get to the end of the rib cage and start coming into the lumbar spine. And he is a little hyperflexed, or technically like a little bit roached in his low back. So there's a little bit of an upward curvature here. There's a little bit of a dip as he ties into his pelvis. Now, this is actually a normal anatomical variant. So the spinous processes on the lumbar spine are actually very short at L6, which is the last lumbar vertebra. It's like half the height of the other lumbar spine. So it is normal to see a little bit of a dip here. What you can't see on this picture is this horse is actually holding quite a bit of tension in his lumbar spine. So when you palpate the muscles, he felt fine through the thoracic spine, and everything got quite tense through the lumbar spine. But I think the most telling thing is, like, when we look at the angle of his croup. So this is the sacrum. And when we look at the musculature through the flank, it doesn't look necessarily super tight and tense, but we can see like the stifle has started to straighten. And to me, like the quadriceps and everything look a little tight in here. And, as we look at the hamstrings, I can kind of see the variation in the muscles here where I can see the different muscles overlapping. So to me, like when I look at this horse's posture, there's too much tension in the lumbar spine and the pelvis. So when you watch this horse move, watching him trot, and especially at the canter, he's got great movement in the neck, like he's able to oscillate and move through the neck, but he's unable to move through the thoracic spine. And the only history I have on this horse is, he was imported, super fancy young horse. He's now 7, completely rejected the way he was being trained, and he's now being used as a vaulting horse. So doesn't really move through the thoracic spine, but has excessive movement in the lumbar spine and the pelvis. So because he can't move through the trunk and the core, so he's actually unstable in his trunk and his core, he's having to overcompensate with the lumbar spine and the pelvis. And when we just observe him standing, we can see this little bit of a roach posture, and then he's hyperflexed in how the pelvis is actually attaching into his body. Okay. So here's another horse, again, just a horse I pulled from a sales ad. And when we look at his horizontal balance, we can see, when I measure from the top of the wither to the top of the croup, there's a huge discrepancy here. But when I measure from the elbow to the stifle, like the horse is balanced. So when I look at this, everything I would see on the horse previous on flash, I would say is postural. To me, when I look at this horse, like this is conformation. His muscling looks beautiful. He's got a little bit of tension in his lumbar spine, but the neck looks soft and beautiful. It's a little deficient, in his shoulder muscles, but I do believe he's young. I think he was like 3 or 4. But when we look at like the size of the front end on this horse in comparison to the hind end, this is conformation. And I would say this is a very classic example of what we're starting to see in modern sport horses. Okay. All right. So this poor horse, I have absolutely no history, excuse me, on this horse, but I thought it was an amazing example of, I didn't even bother to do the line drawings because this horse's posture is so compromised. But hopefully you can see, excuse me, the roaching. I mean, this is truly a roached back where we have hyperflexion. So we have excessive flexion in the lumbar spine. These horses, the hypaxial muscles, so the muscles that sit, excuse me, under the spine, usually due to trauma of some sort, will become very spasmed and tight. So these horses lose the ability to have any extension in their spine. And then if we follow the angle of his croup, which is way too flexed, you can see his stifle looks pulled and very straight here. There's tension up through the flank, but this is a true hunter's bump. So it's, excuse me, just just caudal. So just behind the lumbar spine. And this is where the tuber sacralis, which are the part of the pelvic bone that meet the sacrum. So we've got the sacrum here, or the croup, and the pelvic bone, where they come together, makes up the sacroiliac joint. And we'll get a hunter's bump when the tendons and the ligaments that attach there are under a lot of strain, and they pull on those muscle attachments. The bone will start to remodel to compensate for the excessive force being applied to them. So again, just a reminder, so tendons connect muscle to bone, ligaments connect bone to bone. So usually we see a hunter's bump when the long back muscles and the nuchal ligament, when there's excessive tension, where they tie into that sacral joint and the tuber sacralis on the pelvic bone. The way those tendons and the ligaments pull there causes bone remodeling, which will give you this bumped structure. So again, just a great example. There's a ton going on with the horse's neck too, which we'll get to here in a little bit, but very dysfunctional posture. It actually kind of makes me sad that this horse is being sold as a riding horse, because I look at a horse like this and I'm like, this is a horse I guarantee is in quite a bit of discomfort. So really being mindful, if we have horses like this that we're riding, really being honest about, is it ethical and fair? Can they move through their body correctly and freely? Can they move through their body correctly and freely and not be in pain? Okay. All right, so let's go and look at vertical balance. So the vertical balance, we're going to start with the neck and the thoracic sling. So we'll throw the next stuff, and then we'll come back to the slide and talk about the thoracic sling. But the neck plays a really key role in a horse's balance. So if we think of forward movement, so everybody, where you're sitting, if you think of, initiating forward movement, if you were to engage your abdominal muscles and your gluteal muscles and round your spine, what your neck will automatically want to do, and you can do it, is it'll actually elongate and come a little bit forward. So this is how horses use their neck for balance. As they really soften and bend, through the back and engage the core and allow the hind end to come underneath, that neck should naturally be allowed to come up and a little bit forward. And this is what we talk about when we really talk about riding a horse back to front. It's really that allowing of, and really keeping in mind that true uphill carriage or uphill movement is actually the withers coming high. It's not the pole coming high. So when a horse can truly lift through the back and lift the withers, that head will naturally come up and out, and the pole will naturally fall at the highest point. If we demand it from a horse, where if we just shorten the reins and drive them forward, and if they can't truly lift the back because of they're hypermobile, maybe their tack doesn't fit right, horses mirror our posture. So if we're riding with a really stiff, hollow back, we drive their back down. So for whatever reason, if they can't lift and really move through their back, we tend to shorten the neck, and shortening the neck provides more stability in the whole system, albeit it's not really good stability. But horses lose the ability to truly use their neck for balance. And when that happens, we'll start to see some really compensatory muscle structures in the neck, which I'm going to show you some examples. But the neck, and this is one of the biggest discrepancies I see, the neck actually does a very small amount of lateral flexion. The neck, the cervical spine, so its primary range of motion is actually rotation. So yes, it can do lateral flexion. Yes, it can do forward flexion, which is coming around. And yes, it can do extension, which is pushing the sternum to the ground, or, putting the nose up in the air and bulging from the under neck is extension. But the way the vertebrae actually attach in the neck, it's designed primarily for rotation. So rotation is actually the movement that allows what we would call lateral flexion of the neck. True lateral flexion in the cervical spine is the amount of flexion that you would actually see like when you're doing a leg yield. When we ask the horse to bend a little bit through the rib cage, or we can just see a little bit of the inside of the eye. True lateral flexion is when, the forehead of the horse, like when that stays on a vertical plane. And I'm going to show you a picture here. So here's a lady doing a carrot stretch, and you can see, there comes a moment, and I'm sure everybody's done a carrot stretch with a horse at some point, where they initiate in true lateral flexion, and they usually get, about 15 degrees off that midline. And then, for them to keep flexing, the only way they can do it is to put rotation in the neck. And then all of a sudden that range of motion increases, and they can get the nose, back towards the hip, the flank, or the stifle. So again, keeping in mind that the neck, its number one range of motion, although it can do everything, its number one range of motion is rotation. All right, so here's some postural evaluations. Again, these are just sales horses. They were all being sold as dressage horses. And when I looked at this horse, I did do line drawings of her. I didn't put them on here, but a little uphill, when we compare the wither to the top of the croup, but actually very balanced from elbow to stifle. So I would say conformationally, pretty balanced horse with a little bit of an uphill tendency. So when we're looking at the neck, the number one way we can tell if a horse is truly working through their back, engaging their core, and lifting through the thoracic sling is we look at these neck muscles. And one of the first things we want to look for is like, do we see a dip in front of the withers? Typically when we see a little bit of this atrophied muscle, and sometimes it can be really exaggerated where the rest of, the top of the neck is really overdeveloped. That usually tells me that there's a weakness in the thoracic sling. They're not actually lifting through the wither, and they're using this brachiocephalicus muscle, which is one of the under neck muscles, to actually lift this front limb off the ground. So again, when I look at this horse, I see a fair amount of tension through the neck. We see, the striation here. So this looks really ropey and cord-like. We really want all of this to be soft. So looking at all of the under neck connections here look tense. And then again, this brachiocephalicus muscle, which runs from the pole all the way down into the shoulder. To me, again, this looks really tense and tight, and it actually looks like it's rigid and hanging on here. And then we can also see, to let you guys know, so C1, so the pole is actually right behind the ears. The horse's vertebrae actually run down the bottom part of their neck here. So we can look at the jugular groove. The vertebrae sit just, and they have 7 cervical vertebrae. So C6 is typically right in front of the scapula here. C7 sits under the scapula, and then T1, T2, T3 start to climb up the scapula. And then the beginning of the withers is usually the 3rd thoracic vertebra. And then it's kind of a generalization, but really when we look at the bottom of the withers here, that's around T12. So when I look at this mare, we can actually see a ridge where the serratus muscle, which again is one of the thoracic sling muscles that allows the horse to really lift through the withers. We can actually see where it attaches into the vertebra here. And I swear there's like some color changes. It's like I can almost go through and see like where each vertebra sits. There's so much muscle tension in this horse's neck. So when I look at a horse like this, and we can see like she's atrophied, behind the scapula, all the muscles of the thoracic spine are really deficient. Even when I look, the hamstrings, everything like through the quadriceps here just looks really tight. But when I look at a posture with a horse who's technically her bone structure is balanced to uphill, to me, this is a horse that's spent a lot of time in side reins, draw reins, or a martingale, or anything that's really forced her into a posture that she wasn't able to hold on her own. So again, I felt this was a great example of just tight and ropey musculature. Like again, I describe these horses where it almost looks like their skin's on too tight. And that's, the fascia that covers the muscles. It's like this silvery coating that's actually full of neurology. When that fascia becomes dehydrated from just lack of muscles aren't able to function and fire appropriately, and they're just holding too much tension, we can see all of these muscle attachments and insertions, and we don't want this. Okay. So yeah, this is just a picture indicating where the serratus muscle attaches into this lower cervical spine. Again, another sales horse here. I thought this was a great example of a very, horse that's very flat through the lumbar spine in the croup. I did line drawings on this horse as well, so pretty level. From elbow to stifle, and a huge change. I mean, if we look at like the height of the wither to the height of the croup, I mean, there's like a huge discrepancy. So this horse technically very uphill, which we might be thinking is a good thing. But when we look at the neck, this horse was 7 years old, 7-year-old horse. So again, just kind of noticing, like, what do you see? Does this look like a horse that has a happy neck? Does it look soft and pliable and mobile? I see a little bit of a dip in front of the withers. It's not significant. But again, we see this giant ropey striation where, again, this is a horse that for whatever reason, instead of, dynamically being able to move and use the neck to lift through the back and create stability in its spine, and it probably has something to do with how flat it is through the back and the croup, it may not be able to generate enough sitting and pushing power. All of the tension in this horse is being held in the mid and upper cervical spine. I mean, we've got these huge muscle striations. Again, we can see where the muscles insert. There's tension in the underneck. The serratus muscle is really, really tight. So yeah, to me, this, I look at a horse like this and I go like, what a kind and generous horse, because this horse has to be uncomfortable. So I'm just circling, obviously, the areas of dysfunction. Okay, so I did put a line drawing in for this horse. So we can see balance, through the elbow and the stifle, and then we can see the huge discrepancy from the top of the withers to the top of the croup. Okay, so let's go back and talk about the thoracic spine and the thoracic sling. So the thoracic spine is the part of the spine that makes up, it's where all the ribs are attached. So it's the part of the horse that we sit on. It makes up the withers. The ribs attach up at the thoracic vertebra, up at the top of the spine, and then they attach down through costal cartilage into the sternum in between the horse's front legs. The thoracic spine, its primary range of motion, so again, its primary is lateral flexion. So all lateral flexion, when we look globally at the whole body, is generated from the thoracic spine. So when we look at the angles of how the vertebrae attach to one another, they're really set in this very horizontal plane to allow for lateral flexion. And then we also have the rib head attaching here, and that's held together, with 5 different ligaments that allows for, respiration. So we get a little bit of rotational movement at the rib heads. So lateral flexion through the horse's core, it happens at the thoracic vertebra and where the ribs attach at the thoracic spine. I've seen, some thoughts going around from riders and the judge saying how horses, it's impossible for them to bend through the rib cage. Well, the ribs actually move quite a bit where they're attached up at the thoracic spine, and those thoracic vertebrae, they primarily just want to do lateral flexion. So when a horse can actually engage the core, when we look locally, so local meaning just the thoracic spine versus globally looking at the whole body, a little bit of lateral flexion at the thoracic spine can create a tremendous amount of bend up through the neck and through the low back and the pelvis. So I can totally understand how somebody would look at the outside of the horse and see a lot of movement at the neck and see the haunches coming to the inside and say, like, all of that lateral flexion is happening in the neck and the low back. When in reality, when we look at the spine, all lateral flexion in the body initiates at the thoracic spine. So if a horse, whether it's from trauma, injury, poor saddle fit, poor rider posture, if they can't move through the thoracic spine correctly, so if they can't lift it and laterally flex, you're always going to see excessive tension in the neck and the low back. So I really see this thoracic spine. It's so important for horses' mobility and just for them having good posture. So, and then that brings us into the thoracic sling. So the thoracic sling are all of the muscles that attach the whole front limb. So the scapula and the front limb is just held to the body with a bunch of muscles. And I'm sure most of you know horses don't have a clavicle like we do. So because we don't have bony attachments holding that whole front limb on, the benefit is we have tremendous range of motion. The downside is if horses have incorrect posture, and if they're not, or if they just don't have the strength to utilize that thoracic sling, those muscles atrophy, and we actually see a lot of dropping in the thoracic spine, which can lead to kissing spine, and then we see a lot of tension in the neck. So a horse's ability to really use the thoracic spine is a really critical component to having healthy posture. And Dr. Hillary Clayton, she's researched equine biomechanics, and she really, in my mind, is the gold standard that all of this work gets built upon. But she really defines the thoracic sling and how a horse should move through that is the equivalent to doing a push-up. So if we were to imagine like a push-up or a plank where we're not on our knees, like we're on our toes, and if we do, lay on our belly and do a push-up, first of all, just acknowledging how hard that is for most of us. But that's what a horse is having to do every time that we ask them to truly lift through the back and lift through the wither and really carry themselves. It's the equivalent to doing a push-up. So they really have to engage all of those pectoral muscles and all of the muscles that sit in between the scapula and the rib cage. I mean, they have to be mobile enough and strong enough that a horse can actually push off the ground and get the withers up. So I'm going to show you some examples of some not so healthy thoracic sling development. And all of these horses that we saw with neck problems, we can go back through, to me look deficient in their thoracic sling. But again, this horse, it was another sales ad. So you can see the extreme atrophy on the back. So when we look behind the scapula, I mean, this is just hollow. So all of the longissimus dorsi muscles, which are the long back muscles, which actually attach. So the longissimus dorsi, it attaches up into the neck. So it really supports the spine and upward mobility. And it also works in concert with the thoracic sling muscles to allow a horse to really lift through the sternum, engage their core, and allow the hind end to come underneath themselves. So again, when I look at all of the tension, in this horse's neck, you can see, where all of the muscle attachments are along her cervical spine here. The trapezius muscles, I mean, we can literally see where the cervical branch of the trapezius, inserts in here. So this was actually an upper level horse being offered for sale. And I mean, and this is the reality that, these horses can often still be very competitive, still do a good job, not complain about their job, and still pull good scores and be in what we would call biomechanical failure. So when I look at this horse and her posture and her muscling, sadly to me, I'm like, this horse has got to be in a lot of discomfort. I mean, I can't imagine how uncomfortable a saddle would feel. Like there's literally no muscle structure to help pad or support the weight of a rider or a saddle. But also, she's really having to pull from other parts of her body to get her job done. So let's see. All right, so Gerhard Hauschmann, and I hope I'm not butchering his last name. He's a German veterinarian and a rider. He's ridden, I believe, up through the FEI levels, but he has a bunch of amazing books. I love his book. It's called Collection or Contortion. He has beautiful illustrations of spinal mechanics and how the spine moves. And I think this is a great picture. And again, it's hard to draw an illustration that's like perfectly perfect, but if we look at this picture on the right, we can see that lateral flexion is being initiated through the thoracic spine. So we can imagine, like if a rider's left leg, if their calf was asking the horse and their weight distribution, to yield through the left side of their rib cage, if they're not being forced in the neck in any way, if we really think of physics and mechanical advantage, when they bend through the rib cage here, the neck will naturally, curve, like the whole spine will naturally curve. So for everyone sitting there, if you sit up tall, not forcing your posture, but if you, put a force on your rib cage, like let's go on the right side. And if you were to push like it were a leg, just being mindful, we'll keep our spine straight. And then if we just bend through our thoracic spine, I mean, we naturally, as I do that, I feel my weight shift onto my left seat bone. My neck will automatically, like my whole body will automatically arc, but I'm not pulling my neck. I'm not forcing my neck. So it's really thinking of, when horses are biomechanically correct and moving through their body correctly, a lot of these movements, become relatively effortless. Like we don't have to micromanage everything, but we have to allow these horses the time, and we have to have the ability to allow them to develop correctly. Where this horse on the left is being pulled. So there's really like the thoracic spine is straight, so there's no bend here. And we can see, or I hope you can see, this horse is having to hyperflex its lumbar spine because there's no mobility here. And we actually see there's rigidity in the cervical spinal vertebra, and it actually throws all the weight out through that right front limb. So this horse is actually very much out of balance. So I just thought that this was a great picture, just really depicting correct thoracic spinal biomechanics. And again, this is just a picture of the thoracic sling muscles. So we have the thoracic vertebra here. This is the ribs. We've got the sternum down here. And it's just showing the pectoral muscles, the serratus muscles, got the subclavian. So again, these are all the muscles that we would imagine if we were doing a plank or a push-up. I'm sure you would imagine like we would have to use a tremendous amount of our pectoral muscles. Our core would massively have to engage to keep us stable. We would have to also engage the gluteal muscles. So if you imagine yourself doing a push-up and then going into a plank position, and then allowing your scapulas to slide away from your spine. So if you were to imagine if you had withers, lifting them. So again, just to reiterate, you know, when we ask horses to really be in true self-carriage, this is what we're asking them to do. So you can imagine, you know, as we're developing an athlete, you know, imagine like if you were starting from ground zero, you know, how many push-ups could you do? How long could you hold that plank? You know, would it motivate you or be easier to do it for a little bit of time and then have a walk break, or to be able to take a break? So again, just really challenging everybody to really, you know, as we understand what the body is doing, extending our horses a little bit of compassion. You know, this is hard work. You know, it's very hard work to do these things correctly. And, you know, doing a 40 to 50-minute ride may not be possible as we rehab posture or develop correct posture from the beginning. Okay. So again, I just really like this picture because we can see, I don't like it for the horse, but we can see the atrophied thoracic paraspinal muscles. So all of these muscles behind the scapula, completely atrophied. So I just see this horse, you know, really not having great thoracic spinal mobility. Yeah, it's kind of taken at a funny angle, but I would imagine if I were seeing this horse, you know, straight from the side, seeing some overdeveloped lumbar muscles as well. That's what I would expect there. Okay, so again, just another sales horse that was being sold, you know, as an upper level dressage horse. You know, again, just softly looking at the neck, I see some divots here. So just a lot of muscle tension, tension in the underneck, in this brachiocephalicus muscle. We can see the parotid gland. I've got another great picture of it, is actually enlarged, and that's just from horses being ridden too short in the frame. The parotid gland is the main salivary gland, so it helps produce saliva. And when horses are ridden really tight in the throat latch, that it actually compresses that gland, and you can get a lot of inflammation. I know in people it's horribly painful when that happens, so I can't imagine it feels great for these horses as well. And again, just for an upper level schoolmaster, just quite a bit of atrophy behind the shoulder and at the back panel where the saddle sits. So I included this, just a picture of the parotid gland, you know, just seeing a lot of inflammation there. And again, this is just another picture of, you know, just a horse being ridden too tight in the throat latch and having that parotid gland inflamed. So again, you know, doing this without judgment, but really from a place of education, you know, taking, you know, as we start to map the body and understanding how we want it to look and feel and how it should be moving, I think it's an interesting exercise just to start looking at, you know, horses that are competing at a high level. And like I said, a picture is a moment in time and it can be very deceptive, but the muscle structure never lies. All right, I know we're running out of time, so I just want to get to the modern sport horse. So I think it's amazing on one hand that we are starting to breed these really spectacular hypermobile horses. It allows for the beautiful movement, the big range of motion that is just absolutely captivating when we watch it. But what we need to keep in mind is because horses have the ability to move this way, they are inherently hypermobile. So we have these longer, taller, leaner, far more athletic horses than what we had 20, 30, 40 years ago. And they're highly elastic. So when we have hypermobility, we have an increase in range of motion. So we have excess motion in the joints. So when we have excess motion in a joint, we have decreased stability. So we have increased range of motion and decreased stability in the body. And that isn't just in the limbs, that applies to the whole spine as well. So we've got these hot athletic horses that already have excessive movement and don't have a lot of innate ways of stabilizing themselves. And again, we talked about earlier, hypermobility can really cause, well, in people, hypermobility is actually linked to increased pain. So we have what are called mechanoreceptors that are, around the joint capsules in the tendons and ligaments. And these are nerve receptors that when they get stimulated, so when they get stretched or compressed, they send a signal to the brain. And then the brain then sends a signal to the muscles, telling the muscles how they need to engage to keep that joint structure stable. So and then we have nociceptors, which are pain receptors. So we've got these hypermobile horses that, all of their joint mechanoreceptors and pain receptors, the nociceptors, they're being fired quite a bit. So people with hypermobility typically have far more joint pain than people who have normal joint stability. And they've done a lot of research in horses and in people that a lot of that can be linked to a decrease in collagen in the soft tissue structures. So there are some vets that are really starting to look at, are these hypermobile warm bloods, like, are they innately collagen deficient? And is that why, we see, an increase in soft tissue injuries and everything like that. So, okay. So I'm going to paint with some very broad strokes and just some of the things that I've noticed in the German bred warm bloods and in the Dutch bred horses. Now, again, I'm painting with broad strokes. We see this in all of the warm blood breeds, but we're just breeding really tall, leggy. When I look at the German horses, they've got these big scapulas. We're now like seeing the modern sport horse back as this really long wither. And that really facilitates like this big, swinging movement of the front limb. So let's talk about why that becomes a problem. Aside from the excessive movement, where that becomes a problem for a ridden horse is when I'm going to flip a picture here. All right, so when we have, a horse with a really long wither, as a rider, we want to sit as close to the base of the horse's wither as we can. So a horse's center of gravity is typically right in the heart girth, which here I drew a line. This pink line shows like the horse's center of gravity. So, as riders, for us to be a good load to carry, we want our weight to be as close to a horse's center of gravity as we can. So as we're breeding horses with these much longer sloping withers, this blue line is, if we were sitting bareback on a horse, about where we'd sit, and we can see how far away that is from the horse's natural center of gravity. And then you put a big saddle on there, a saddle with a giant thigh block so that we can sit on these giant moving horses. These big thigh blocks are, riders tend to like them because they give a sense of security and safety, but they actually place our weight even further back on the horse. So we get even further away from the horse's center of gravity. So I think in reality, with a horse who's built like this with a very traditional, or what I would say is a very popular dressage saddle style now with, a deep seat and a big thigh block, we're now sitting on one of the weakest and the most vulnerable points of the horse's back, where our weight, is actually being put down their back through the center of their belly. So to me, again, it's not a surprise that, kissing spine has become really prevalent. We've got hypermobile spines that are hard to stabilize. We've got, dressage saddles that are covering more surface area on the horse's back that are placing the rider's weight even further back on the spine. It's just a bit of a tricky situation. So, we already talked about saddle stuff. So let's look at a couple more horses here. And then the Dutch horses. So what I tend to see, in general, the German horses were getting these bigger, longer withers. The Dutch horses, like a lot of the horses we're seeing, they're being bred with these gigantic shoulders that are conformationally uphill, but we then have a disproportionately weaker hind end and pelvis. So, these giant shoulders allow for that big knee action, but these horses naturally want to go or need to be in a very short frame to provide enough stability. These horses, I tend to see a tremendous amount of neck tension and just decreased range of motion in general. And these horses start to look like German Shepherd dogs. We've got these big front ends. They are technically moving uphill, but they don't really have the support structure of the hind end to biomechanically support that. So with these horses, I would expect, degeneration in the sacroiliac joints, the coxofemoral joints, which are the true hips. So where the femur, attaches up into the pelvis. So again, I think this horse is, albeit very beautiful, a great example of, we've got a shoulder that's taller and just bigger, when compared to the hind end. This horse as well. I did the line drawing from the top of his croup, but you can see the discrepancy from the top of his wither, to the top of his croup. When we look at his neck, we've got a dip here in front of the withers. There's tension, in the under neck. And even though he looks kind of fluffy and shiny, it looks to me like, there's a little bit of a hollow behind the scapula and basically just atrophy through the back. So again, to me, this just signifies, and especially in these horses that are built in this uphill manner, when they aren't actually, lifting through the back, engaging the core, shifting the weight on the hind end and propelling themselves forward and using the thoracic sling, they end up using this brachiocephalicus muscle. So this muscle that sits on the bottom of the neck, they end up using that to pull the front limbs off of the ground, which, can absolutely cause neck pathology. You're adding concussive force on the front limb because, we don't have this whole body support structure that's allowing the front limb to lift off the ground. They're using their neck to pull their limbs up off the ground. So I always worry about these horses, in the hoof and the fetlocks and the pasterns. And again, this horse, I'm assuming it's a young horse. I don't know. It's just a picture I pulled from the internet. But again, we can look at how long and sloping this wither is. We've got this gigantic shoulder, to me, disproportionately a smaller hip. And we can already see this brachiocephalicus muscle. Now, I'm sure this horse has a lot of adrenaline pumping through it, but, there's quite a bit of tension. I mean, we can see the muscle attachments in the neck. And if we look up behind the poll, there's already some bulging, in the muscles behind the poll. So this tells me, this horse isn't in this pole high posture. It looks like it's lifting through its back, but it's still using, embracing, and stabilizing a lot with its neck to allow its body to move. So again, I would just be worried, when you start to see something like this in a young horse, what is their longevity in sport? Is their body going to be able to handle, are they going to be able to be a Grand Prix horse? And I think that's one of, the big dilemmas we're facing is we're breeding these horses with beautiful but excessive movement. We're bringing them along very quickly because they're very talented. I'm going to come back to that. This horse, I think while it's not a conformational masterpiece, it's sort of my concern, when we look at, some of the modern sport horse breeding, and this horse is a 2-year-old. So it's still growing, but seeing this giant shoulder, it's having to really leverage through the lower neck. It's just weaker in the hip. And, even as a 2-year-old, it's bulging through the under neck and hyperflex through the upper part of the spine. So, let's see. All right. So with these modern sport horses, what do we do, and what is the pathway forward? So the number one goal, and I think this is true of just developing a dressage horse in general, is we want to help these horses find stability. So when we have these hypermobile super athletes, stability, and it really has to come from stability in the back of the core, and the core is really key. And this is where I love, Gerd Hauschmann's work. He's written several books that are just phenomenal. I think they should be required reading for dressage riders, trainers, coaches, and judges. We can absolutely stabilize a hypermobile horse. It just takes a lot longer. And it's really going to require us to start rethinking our timelines for young horses. And, Dr. Hauschmann talked about, it takes 2 years. A year and a half is like fast tracking, but 2 years to really develop correct core strength and stability, back strength and stability, and thoracic sling strength and stability. I mean, that's really a 2-year process if you're taking a horse from zero fitness into, just being a functional athlete. And to me, that would be, a horse that can go out and competently do first level. I mean, that's if we do it correctly and really give the horses the time that they need, that's a 2-year process. So what I see is a need for, allowing these horses to develop at a slower pace, allowing these young horses to learn how to use their neck for balance, which means not always putting them in side reins, not always lunching them on a 20-meter circle. It's incredibly hard for them to find balance when they don't have adequate core strength in their body. Keeping them on a circle, it's actually biomechanically very hard for these horses to do correctly. So if we're going to lunge them or work them on a line, incorporating straight lines, doing transitions, on a line, without side reins, so they learn, in a transition, how to elongate the neck so they can lift through the withers. That's critical. When we put them in side reins, we take away that ability. So we rob them of the ability to develop correctly. And I think it's only done because I think there's a lack of understanding of how the spine needs to move for these horses to develop. I think a lot of it is done with very good intentions of, if we put these horses in what looks like a great posture, then they'll develop the correct muscles. And what we're actually doing is strengthening compensatory muscle patterns. So really slowing down the horse's trainings, letting them learn how to navigate their body in a longer frame so that they can actually develop the core strength to lift the back, elongate the neck, and then learn how to push themselves up and carry. Dr. Deb Bennett has done a bunch of wonderful research on spinal development, or just the rate at which the bones develop in horses. And the growth plates that are the last to close are in the thoracic and the lumbar spine, and they close at the end of the 6-year-old year. And I've seen in some breeds, horses continue to grow until they're 8, 9, 10. So thinking the most expedient growth process, when your horse is 7, I think it's safe to assume they're then skeletally mature. So really being careful what happens between their 3-year-old year and their 7-year-old year, and not pushing them too quickly. I really find with horses that at 3, 4, and 5, if they can have a very intentional exercise program that doesn't follow the traditional young horse timeline, these horses have far less injuries, and their ability just to have health in their body to continue to do their job. A lot of these young horses that are pushed along, we just see a lot of pathologies that end up being career-limiting injuries down the road. So really slowing down the training process and really allowing these horses to develop and grow into their body. Excuse me. Also being mindful, every time a horse goes through a growth spurt, let's say they go really croup high, it takes their nervous system about 3 weeks to catch up to what their bone structure is doing. So a lot of these young horses too, they go through big growth spurts, and they just don't have, I mean, they truly, like, their nervous system hasn't really caught up yet to how their body is growing. So it always worries me a little bit, when these horses are like super croup high and nothing in their workload changes. If you've got a young horse that's really croup high, this may be a great time to really slow down and work from the ground or do work on the line so that we don't add our weight and again, strengthen compensatory muscle structures. And one of my favorite, sayings, and I think this applies to the young horses and the modern sport horse, is just because they can doesn't mean they should. So just because we've got a 3, 4, or 5-year-old with extravagant talent, and because they can go in an upper level frame and look fancy, doesn't always mean that that's the best thing for their long-term soundness and their ability to become, a Grand Prix horse, if that's your goal. So really just adjusting our focus a little bit. Okay. So some resources, and we'll open this up to questions. If anyone has any questions for me that I can answer. If you would love to stay in touch, I think these are all really important conversations to have, and I would love to do more educational events. You can contact me through my website. It's just tracyrainwaters.com. If you're interested in other teaching opportunities or other online educational opportunities, I'm signing up for my email list. I promise I rarely send out emails, so I won't inundate you with anything. And then you can also find me on Instagram at Dr. Rainwaters, or just Dr.Rainwaters. And then these other resources that I have, I do not financially benefit from these whatsoever. I just think they're wonderful resources for you guys to have. But Equine Bodywork Online is an amazing platform. You can also find Kara on Instagram under Equine Bodywork Online. She has really taken Dr. Hillary Clayton's work, along with being an equine body worker, and has developed a platform that is very easy for owners to utilize and to understand how the body works and how you can do stretches and exercises to help support your horse's body. So she's been really generous, and she's got a code for 30% off. So if you would like some at-home exercises to help, support your athlete as you go through and look at their top line and start assessing their posture, I highly, highly recommend her. And also she's on Instagram. She has a bunch of wonderful free content on there as well. And then just the book Collection or Contortion by Dr. Garrett Hauschman, I absolutely love. And then it's a podcast. It's called The Horse First, a veterinary sport horse podcast by Dr. Audrey DeClue, is absolutely phenomenal. Dr. DeClue, she's a sport horse veterinarian in Florida, and really is just providing some really groundbreaking work on really looking at, body lameness, a lot of the conditions that we thought were genetic or neurological. She's really debunking a lot of those and really relating it back to biomechanical problems and how we can help our horses. So I highly, highly, highly recommend her podcast for anyone who's looking for more information from a veterinary perspective on keeping these sport horses sound. So yeah, if anybody has any questions, comments, I think you'll probably have to unmute yourself, but you can pop on and just ask, and I'm happy to answer whatever I can.
Hi, Tracy. Thank
Hi.
you so much for this. This has really been an informative session. There's so much to take in.
It's a lot.
It is a lot. And we thank you so much for preparing this and sharing all of this with us.
Yeah.
One of the things that I notice on my horse, he's got a couple of those tight indentations, or one specifically that worries me. He's had it for years. How do we go about getting rid of those? Because it obviously is a compensatory problem, but it's only on one side, and it's in this one spot.
Yeah, so I think one of the best things we can do is just really putting our hands on our horses on a regular basis. So, and I really encourage people, even if, you're in a training program, where maybe somebody else is doing the grooming and prepping your horse for you, still making a really regular habit of feeling down your horses, down their neck, down their back, over their gluteal muscles. And when you find like an indent or an area of tension, we don't have to go in hard, but we want to go like against the muscle. So we can stroke with the length of the muscle, but just really starting to rub into these areas of tension. And how that becomes beneficial is we not only increase blood flow, but we also wake up the neurology to areas that might be overcompensating or undercompensating. And when we can stimulate the neurology, it kind of tells the brain like, hey, like something's going on here. Because what will often happen when we have compensatory postures that the body can't resort for a long amount of time, in the most simple explanation, the nervous system will kind of, it's like having like a lot of repetitive noise, like it'll kind of just start to tune that out and put its attention to where it can actually help the body. And that's a very simplistic explanation. So again, just rubbing into these areas before and after you ride. Again, to get the blood flow, we can wake up the neurology to the muscles and really just help release some tension that we're being held there. Nobody has perfect posture. So I know everybody, I mean, even my horses, like I can go through, they all have their stuff. So really just being keyed into what is normal for our horse or what has changed or what's getting better or worse. I love doing the line drawings, and I actually highly recommend, everybody taking
You just broke up.
Oh,
We lost you.
oh, can you hear me?
There we go. Yeah.
Okay. So taking a side view picture of your horse, I just take it with my iPhone. And then if you go to the edit button on the photo, for me, it's in the upper right corner. There's like a little pen. And when you hit on that, there's like a ruler, and you can, just put the ruler at perfectly level and start, doing the line drawings on your horse. And I would really encourage you like once a month to do that and just start comparing, over time, like, is my horse's posture getting better or worse, or is it just changing? Because I think too, when we see them every day, we can just kind of lose sight, as to what we're seeing.
Right. That's a great idea. And then what about the use of things like the red light lasers, the red light infrareds and so forth on those areas that are showing tension?
Yeah, I love laser and red light. It basically, we're putting energy into the body that the mitochondria of the cells pick up, and they produce more ATP, which is the metabolic fuel that we use for everything. So I see like red light and laser, it's like money in the bank metabolically and physiologically for our horses, and really safe. So, we're just giving the body more of what it needs to heal and repair. So anytime we utilize muscle, we are actually catabolizing. So we are breaking down the muscle tissue. So giving the body what it needs to repair efficiently and very effectively is fantastic. And the red lights and the cold lasers have been proven to really decrease pain and inflammation. So I think using those on a regular basis is fantastic.
So would you use, say, a red light pad before work or after work?
For me, it's like, if you guys can just do it, do it. For me, the most important thing is like, if you can just do it, that's the most important thing. I would be more inclined to do it after to help the body repair, unless your horse is rehabbing, or if you have an old injury that you need to support them through, then I would do it before. But just from my mind automatically goes, it's really helping the body recover from exercise.
Okay, that's good, because I always do it before just to get the area warm. So I was thinking maybe that was, and then as you were talking, I thought, maybe I should be doing it after. So, okay, that makes sense.
Yeah, and a great recovery. Is how our horses, and this applies to people too. So how we recover from a workout sets us up for the next day. So I think we tend to put a lot of focus and attention on warming up and not enough attention on cooling down and how we recover after a workout. So if we're going to do 15 minutes of walk before we go to work, we need to be doing at least 15 minutes of walk after we're done working as well. And I think, again, doing the red light after, just to make sure that we're really giving the body everything it needs to heal and recover.
Okay, great.
So, yeah. And yeah, I realize, this is such a broad topic, and it was really hard I feel like we could do a deep dive into any of these. So hopefully it wasn't information overload.
Sorry, that's my dog snoring. No, obviously it is a lot, but at the same time, people can reach out to you, and we're happy to do the same via our website. So are there any other questions anybody want to pop in?
I just saw somebody posted, is there a certain cold laser unit that you use or recommend? I have a medical grade cold laser. That's not available to the public, but I think Revitavet has wonderful products, that owners can buy directly. So that is typically the brand that I recommend.
Great.
So, yeah.
Okay. Anyone else have a question before we let Tracy go?
Another secret plan was hatched.
All right. Well, thank you all for joining in on this, and I hope you will join in on our following educational sessions as well. Tracy will be doing a live breathwork clinic with us, and you can go on our website to look at any of the other educational sessions we have coming up. And if we get enough interest, we'll do a second with Tracy when she can fit us into her schedule. But again, thank you so much, Tracy, for all of this information and for the time you spent putting it together, because it was very, very thorough and yet completely made sense. So I hope everyone goes back to their horse tomorrow, takes a good look, and says, how can I do this better? So thank you very much for joining us, everybody, and have a great evening.
All right. Thanks so much. Thank you, guys.
Bye.
Bye.